What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
Doing wonderful. Hey, everybody. Thanks for listening to us once again. We really do appreciate it. It's one of those things where we enjoy doing it, but we really get some motivation to do it more when we realize people are actually listening to us.
Yeah, absolutely. Or how we can help you if you want to drop us a
Yeah,
line of a topic we haven't covered or something you're looking for more in depth or any feedback on which direction you kind of like the show to go so it works for you.
right. Anyway, this is the Well Man's Podcast, man, in terms of mankind. So it is also for women. So just want to make sure people know that. I get that comment every now and then, not as much as we used to, but just want to let people know that. Today we're gonna it's kind of two-part. The first part we did on snoring. Today we'll focus more on sleep apnea. I think sleep apnea certainly can be characterized as the kind of the secondary worst form of what snoring can lead to. And so sleep apnea is just the periodic disruptions of normal breathing during normal sleep, which is kind of the basic definition of it.
It does not sound good.
No, it
really
doesn't. It's not good because you actually you actually lower the oxygen levels in your blood, right? So your blood oxygen levels go low from these constant interruptions of not breathing, and it creates nervous system dysfunction, and then also you get sleep fragmentation. So you can see how that's going to feel like every morning you get up with this. It's kind of characterized with people kind of they stop breathing, and then because they stop breathing, their CO2 levels kind of raise in their blood, and then it kind of wakes them up to take a breath. So they're constantly waking up. They're not going into really good cycles of deep and REM sleep. So that's why they feel tired. And you can imagine, so if that's happening, then we've talked about sleep a number of times on this podcast and how interrupted sleep relates to all kinds of comorbidities, right? So we're talking about cardiovascular disease, we're talking about diabetes, dementia, just feeling miserable, irritable. Also, it relates to, even though obesity is one of those things that is certainly correlated with sleep apnea, it goes both ways. So obesity can cause snoring and sleep apnea, and then snoring and sleep apnea can also cause obesity. So it's like this vicious cycle with that. And obesity is related to diabetes and cardiovascular disease. So it's one of these things where you really want to get it under control. And that's why I want Bryan, we were talking about it. Whereas if we get a handle on sleep apnea, we improve people's sleep. When we improve people's sleep, we improve the whole body. I mean, hell, we improve the whole family dynamic if you really want to get that far, because somebody who doesn't sleep is probably going to be miserable to be around after a while.
Yes, indeed.
Yeah. So as we were saying with the snoring thing, it's kind of there's a number of things that are going on here. One related factors as you age, in the back of your throat, sometimes those will narrow. That's just with aging alone. But with obesity, you get like fatty deposits, maybe you have swollen adenoids, tonsils. When you're sleeping, especially on your back, which makes snoring more likely, also sleep apnea more likely, the tongue will fall back, the soft palate will kind of sink down into the airway. And another thing that can also happen is this. Normally, the epiglottis, that's kind of like your lid that goes over your trachea when you eat food. Normally, that stays open while you are asleep, but people with sleep apnea will close, and that creates more of an obstruction also. So it's like trying to get air into this little narrow pathway, and sometimes it just, it's closed off. And sometimes almost completely for these people. So it's pretty miserable if you're constantly, struggling to sleep, but after a while you have to your body forces you to wake up so you can actually consciously take a breath.
I imagine you're not waking up very the birds aren't chirping and the sun is just barely grazing your sheets.
Not at all. Yeah. And one of the primary treatments for is called this, people get on the CPAP, and this it's crazy to me. Like, and for a lot of people, it's really uncomfortable, but people who have severe sleep apnea, they get this CPAP. As soon as they use it and fall asleep, they're like, oh my gosh, I feel like a different person.
Yeah.
And it's create, this positive airway pressure that just opens up those, the airways so you can actually breathe. There are different types of sleep apnea, so I just want to go over those real quick. There's what most people have heard of, obstructive sleep apnea, and that is kind of where the what I just described, where the airway kind of narrows. It's very common in adults. It's very common in people overweight, high BMIs, that type of thing. It's more common in men than women, although women certainly have it. It seems like the numbers, this is very interesting. It seems like the numbers of women with sleep apnea go up after menopause. So that led some people to think, well, maybe estrogen plays a role. As of yet, there's no definitive correlation that we can say. But that's interesting, right? It may also be due to a lot of times weight gain. You're easier to gain weight, especially as a female after menopause. So maybe that has something to do with it too. The other one is central sleep apnea, and that's just where the natural breathing reflex, which is regulated by the autonomic nervous system, just doesn't respond appropriately to the blood carbon dioxide levels. So, the regulation of that is being disrupted. This is very rare. You can see central sleep apnea in infants. You see that quite a bit, both preterm and term, and some adults, but it's much less common. It's like 1% of adults compared to the obstructive sleep apnea. And then there's mixed or complex. That's just a mix between obstructive and central. And approximately 5.5% of the people, 6% of the people with sleep apnea have like this mixed complex there.
So is the central sleep apnea more, sorry, it's way far away from my mic. Is the central sleep apnea more like a chemistry thing? And then the obstructive is, something obstructing the airway?
Yep. Yeah. That's a good way to think about it. Absolutely. Yeah. It's just where the breathing, your unconscious breathing, like when you're asleep, is just dysregulated and it's not necessarily a thing that's related to a narrowed airway due to obstruction, so to speak.
So it seems like that central one would be like related to the autonomic nervous system.
Absolutely. Yeah, it is. Yeah. And if, and I would think that the central one, based on that, would be a little bit more serious. Maybe not necessarily more difficult to treat, but a little bit more serious when the autonomic nervous system is dysregulated. It's very rare. Most people with sleep apnea have the obstructive form of it.
Yeah, it's one I've definitely heard of.
Yeah. We've gone over this, Bryan. We talked about it with snoring too, because they are related. Most people I shouldn't say most, but about 50% of the people that snore probably have some form of sleep apnea also. And when we're talking about snoring, we're talking about real snoring. I mean, I guess one of the ways you can kind of characterize it is if somebody is asleep and their snoring is like rattling the room, or you can hear it through a closed door, and this is consistent day in and day out, every night. And I mean, snoring here and there is not an issue, and certainly is not diagnostic at all of sleep apnea. It's just when it gets really bad, it can bring that on.
That was my next question. As far as diagnosing this and labeling it as sleep apnea, what's the gold standard there?
So to diagnose it, there's different ways to diagnose it, and probably the best way to diagnose it was a sleep study, which we'll talk about in just a minute. And there's certain criteria that you have to go by to get a diagnosis of sleep apnea. And there's, mild, moderate, and severe forms of it. There are also ways that you can kind of self-assess with a form, and I'll talk about it in just a little bit, that you can do at home. The problem with the sleep studies is, you usually have to go to like a kind of like a clinic in a clinical setting to do it, and you're hooked up to all the stuff. You're in an unnatural setting for sleep and all that, but it is pretty diagnostic. But a lot of people are opting to try to see what they can find through home diagnostics first, and even this questionnaire.
Yeah, in short, just in general, what are they reading? The brain waves or seeing how often you're waking up? What are they kind of looking for in those sleep studies? You got to think very soon, like your Aura ring or an Apple Watch or something like that would be able to get pretty close to being able to do that test in your natural sleep environment.
Right, right. Well, let's just jump right into it. So the definitive test for sleep apnea is called a polysomnography, right? It's just a sleep study, right? And it's done in as I said, in a clinical laboratory setting, and it monitors the occurrence of paused breathing and also shallow or slow breathing, right?
Okay.
So, and pause breathing is apnea, shallow or slow breathing is hypopneas. So basically what you're doing is assessing that. You're also looking during the sleep study, you're also looking for neurological stuff and monitoring limb movements, body position, and the sleep wake state. Okay. And so there's sleep apnea classifications. So what we call the apnea hypnonia index, right? So to be diagnosed with mild sleep apnea, you have 5 or 15 episodes per hour. I mean, think about that. That's crazy, right? 5 to 15 episodes per hour. And the clinical presentation for most people is, they have mild sleepiness. They have, and their activities, they can't focus as well on certain things, and they're at risk for hypertension. But it's 5 to 15 episodes per hour of these shallow breathing, no breathing episodes. And then moderate is 15 to 30 episodes per hour, and severe is greater than 30. And then clinically, you're just asking them questions like, okay, if you have severe, does this interfere with your daily activities? So it's basically an interview. Are they more prone to injuries and accidents? I mean, you can imagine, right? If you're not sleeping and you're chronically tired, that we talked about this in some of our sleep podcasts as, being chronically tired or sleep deprived from sleep apnea, based on what Dr. Matthew Walker was talking about, right, with his book, and we did the series of sleep episodes, that is more dangerous than driving drunk. So that's how dangerous it is. And we don't talk about motor vehicle accidents on the highway due to people being sleep deprived, but yet most people are sleep deprived, and many people are severely sleep deprived with sleep apnea.
Yeah. It'd be really interesting to see just like crash data in the morning and the afternoon versus like earlier in the week, later in the week.
Yeah, no, I think we're going to start seeing some of that stuff where, we see this, don't drink and drive. It's like, if you, with things like the Aura ring and things that can assess that. I mean, as the data gets better, I think the ring is actually, or some of these sleep apps are going to be able to tell you, you are equivalently, you should, based on your readiness score on the Aura ring or whatever, it's going to be able to tell you, if you are driving, it's going to be equivalent to driving severely drunk or moderately drunk or whatever. So I think we'll see that, which I think is a good thing. It will really help people monitor this.
Yeah.
There are, so the polysomnography is kind of one of these things where you have to go in a clinical setting. It's a little bit annoying. You go in there, you're hooked up, you have these wires, have this machine on you. I mean, frankly, I've seen pictures. You can go online and see pictures of people in a sleep study, and I don't know. It's certainly not as comfortable as your bed. Let's put it that way. So as an alternative, you can do this home sleep apnea testing, and it's available for patients with, suspected of milder forms of sleep apnea. And it kind of measures the same variables, and you get an idea. And that may be more comfortable for some people to do. But regardless, so let's say you get a a diagnosis for this, the treatment usually is this CPAP, which stands for continuous positive airway pressure. And it really is a first line of treatment. Plenty of studies show the benefits of it. I mean, I think the main thing that people complain about is just it being uncomfortable. There are other things that can happen, like, it's associated with having dry mouth and, bloody nose, congestion, sore throat, reduced sense of smell. By the way, like some people, this is one question I ask my patients: do you ever wake up feeling like you have a sore throat at night? That can give you an idea of that they're snoring or have sleep apnea too, especially snoring. But dryness is a big one. But it's just hard. Some people just don't tolerate it well, and it's a shame because some people just can't sleep like that. So you weigh the advantages and disadvantages, and for some, the disadvantages outweigh the advantages of doing that. What else? There's another one also called bilevel positive airway pressure. It gives you a low level pressure during expiration, higher level during inspiration. So it's just tweaking the CPAP a little bit based on in and out exhalation and all that.
Sounds like the foie gras creation of oxygen for a human. Forcing that air down there.
Right. Yeah. Well, and you could imagine if you're doing that you could get all those other symptoms like dryness.
Yeah, exactly.
Right.
Absolutely. So what are some things? It definitely seems like there's a sliding scale. Obviously, this is super important to get addressed, and that CPAP is the first line of defense. But do you suggest someone goes right into a CPAP first and foremost if it's been recommended by the primary care, and then alongside that, or maybe in conjunction or juxtaposed to that, what natural options do they have? And I can definitely say, just to put in some PT here, definitely positioning. You don't want to bend that trachea and the trachea that you breathe through, the tube you breathe through, making sure your head is somewhat in a nice neutral neck position. So you're not, you're not closing down that trachea just by the positioning of your neck.
Right. So there's a number of options out there. Of course, the science is mostly on CPAP. So that's what we have. They definitely work. They definitely help if you can wear them and you're comfortable. And there's different options out there, CPAP things. So maybe you don't have the one that's the right comfort level, but other options include, like oral appliances. There's something that will help move the mandible. There's a device that can do that where it can hold it in a certain position that keeps the tongue and jaw forward. I could imagine over time that would be uncomfortable and you'd feel tightness or whatever. Sometimes these things can be fitted by a dentist. That's one thing. So, but it is something you have to wear also. So comfort may be an issue there.
Yeah, who knows what it does to your long-term TMJ health? Just thinking about it.
Yeah, no, right. It's like, and your body has to adapt to that for a while, and it may not adapt.
You have braces or a retainer ever, Keoni?
No,
It's super painful. So I can only imagine that as well. Like the first few days of braces or retainer or after an adjustment where everything is adapting.
I could imagine, and it takes a while for your body to kind of ignore those signals, right? Where you can kind of adapt to it. So if that's not really an option, let's say you've done most of the, position and stuff. You tried everything else. Well, and let's just go over those real quick. I know we talked about in the storm, but the other things to try are, what's your hydration status? Do you have any food sensitivities or food allergies? All these things can, if you take care of them, can help decrease the swelling and all that. Have you, are you exercising? Exercise alone, I just want to make this clear. Exercise alone, whether you lose weight or not, can help with sleep apnea. All right. So exercise by itself helps. It can help improve it. The nice thing about exercise, it usually helps you maintain an appropriate weight, but also going on some type of weight loss program is key if weight is an issue. Now it's interesting. I had some underweight people with severe sleep apnea. So it's not always about being overweight. And I know sleep apnea, a lot of doctors will just say, oh, have them lose weight. And we're like, well, this person is underweight and they still have it. So that can happen. And I've seen that.
Well,
What
even
else?
like strengthening and tonifying. So you're exercising, you're going to breathe heavier, or hopefully, and
Yeah.
you're strengthening all these muscles that, whether it's the good God, the diaphragm, whether it's the diaphragm or any of these accessory muscles like in the neck or something like that, the two-tone that we kind of talked about with the snoring episode, making sure these are at a proper level of tone. And then obviously with sleep apnea, that they're working and active during these times. And, it's just going to be a carryover benefit from the exercise, nonetheless, the weight loss and everything you mentioned there.
Yeah, no, that's a good thought. I mean, a lot of it has to do with, well, we talked about, like you said, strengthening them, and even going beyond that, strengthening the muscles of the throat, right? With the snoring, we saw that singing could help. Maybe even humming can help a little bit. I find that stuff fascinating that can do. So, we'll strengthen our big muscles, but there's a lot of muscles in the neck and throat that can also be strengthened. And there are some specific like exercises for that. So you could try those too.
And not that I
See.
have any specific research on it, but even just doing light aerobic activity and trying to focus on breathing through your nose at the same time. So
Yeah,
continuing to rehearse those good patterns.
right. Breathing through your nose. Breathing through your nose has so many benefits. One of the main benefits is one of the main ways your body increases its nitric oxide. And nitric oxide helps significantly with hypertension, cardiovascular disease, and so on and so on. I mean, it's very beneficial for you. So breathing through your nose is huge. But speaking of that, so also making sure that there's nothing obstructing your airways, right? So are there polyps? Is the tissue swollen from allergies? Trying to address those. And so with that, maybe certain, if that is the case, then maybe some medications, whether natural or synthetic, can help with the severity of whatever allergy you're dealing with. So that can help. But there are if there are other things you can do besides the kind of the natural stuff, position stuff, the foundational stuff. Talked about CPAP, talked about like devices, mandibular devices, dental devices that can help keep the palate up and keep the airway open. There's also a number of surgeries out there. There again, the surgeries can have side effects, right? And the benefits, at least with some of the data I'm reading, can range from anywhere from 35% beneficial to up to close to 100% beneficial. There's not a lot of great major studies on that. Surgery would be the last thing I do before surgery. Then think about, prescription meds, pharmacotherapy. There are some things that can help with that too. So what would those be? So some of these things are like certain sedatives. I mean, we've heard of Zolpidem. That's an Ambien that can help you. It can get you into a better sleep than you may be having with severe apnea. So that may be able to help. There is a drug called Diamox. That one may also help. I think it helps that drug. If I'm not mistaken, it helps kind of regulate the CO2 levels in the bloodstream. A lot of these meds are just given to help with the side effects too. So there's meds that can be given for, daytime sleepiness and so on and so on. I mean, so it should be kind of like the last resort or used in conjunction with some of these other things that we're going to talk about in a minute as far as natural goes. I'm going to get to the natural stuff that can help in just a second. I know you asked that, Bryan, but I want to talk about some other things first before we get there. There's also what's called hypoglossal nerve stimulation. And the hypoglossal nerve is just one of the 12 cranial nerves. It's basically involved in the control of the tongue. So, if stimulated, if that nerve is stimulated, then it kind of moves the tongue forward instead of falling back into the throat. So that's another thing that you can do, and it's stimulated by a device, and it's surgically implanted. So again, it's a type of surgery, but that may help. And there's some decent research on that shows that people can get pretty good improvement with that. Again, it's one of those last options. So one of the emerging strategies for this is, I mentioned, is Diamox. It's called acetylzolamide. It's a carbonic anhydrase inhibitor. It promotes respiratory stimulation by improving the body's natural response to fluctuations in carbon dioxide levels. And so with a meta-analysis of 24 studies, this med was found to reduce these episodes by about 38%, was effective in both central and obstructive sleep apnea. So that seems to be a pretty good option for a lot of people. There are other devices out there that are getting some kind of good research. One is called a nasal expiratory positive airway pressure oral negative pressure therapy. Again, it's a variation of the CPAP. So you get positive airway pressure when you expire, and negative oral pressure. It basically, again, it's like what they all do is just try to keep the airways open. So it may be a better way to go with people. It's a variation on the CPAP. All right, so we talked about kind of the lifestyle stuff, diet, weight loss. I mean, that's, everybody's heard that. Definitely, you probably, if you're snoring and have some form of sleep apnea and have a BMI over 30, yeah, you probably have some form of sleep apnea. At least that's what I see in my clinical experience. I mean, that's, if your partner or, people say you snore and everything, you probably have that. And so getting on a good regimen of losing weight, exercise can really help. One thing we didn't mention, that as far as lifestyle, alcohol avoidance, alcohol is associated with up to like a 35% increase in obstructive sleep apnea. So if you like a drink at night, that's one of the first things I do with my patients, get them off the alcohol.
Is that just because of the sedation effect or other things, you think?
Yeah, you're exactly right. It acts like a sedative, right? So it decreases the respiratory center, the activity in the respiratory center in the brainstem.
So same would probably go, well, not necessarily for the brainstem, but like muscle relaxers,
Absolutely.
benzodiazepines, things like that.
Yep. Yeah. Yep. That's right. It's like, again, advantages and disadvantages, so really you want to go back to the foundation and focus there. But yeah, no, you're exactly right. But yes, that's true. You talked about sleep position. That's true for snoring. It seems like people have a much better time breathing when they're on their side instead of being, on their back, or being, in the supine position. I've treated it a few times with acupuncture. I mean, I got some results but I couldn't really tell if it was due to the acupuncture or not, because we did a whole lot of other lifestyle stuff. But there was a meta-analysis with acupuncture, nine clinical trials. Was actually published just recently, that found that acupuncture significantly improved sleep apnea and the daytime sleepiness, and improved oxygen saturation. So that's pretty cool. I mean, it's a really nice thing to the non-invasive treatment that may be able to help. And this was, from what I understand, it was only 10 acupuncture treatments. That's not a whole lot.
Okay.
Now, as far as like, okay, did it last? I don't know. Right. But I would never do acupuncture alone. I mean, if there's other things that you think are contributing, and I know you're this way too, if there's other things that are contributing to, I don't know, whatever, shoulder pain or whatever, knee pain, like excess weight, you want them to also lose weight too, One of the biggies is reduce smoking also. That's a big one. So if you're smoking, try to reduce that as much as you can. And reducing it does help. So I have a patient who, we got him from 2 packs down to 1 pack. I mean, that's a big deal.
Yeah. Absolutely.
So, okay. So when we think about sleep apnea, it's not, it's really from a lifestyle perspective or integrative medical perspective, functional medicine perspective, what is actually happening in the body when we do this? Well, at a real basic level, somebody who can't sleep well and has these intermittent episodes where they're not breathing and their blood oxygen levels are going down and they're waking up, they're chronically tired, you're creating a ton of oxidative stress. So when you create a ton of oxidative stress, it's one of the main mechanisms of how we age. So people with sleep apnea, you start seeing them just like you would with people with diabetes, just they're accelerating at a quick rate. And this is not just something that's, I'm just throwing out there as in theory, this could happen. I mean, they've actually looked at markers of aging and saw that people with chronic sleep apnea just don't age as well. So they're at increased risk for morbidity and mortality. As a functional medicine practitioner, natural doc, there are things that can help offset that. It's not one of the things that I'm going to, go to first, but there are a number of supplements that I can put people on that can help. One of them that I use, and I use quite a bit, is N-acetylcysteine. And N-acetylcysteine, we did a whole podcast on this. It's the precursor to glutathione. So if you just go to the Wellman's podcast, type in glutathione, you'll be able to find that. But anyway, N-acetylcysteine is a precursor to that, your body's main antioxidant, glutathione, and it basically helps quell that oxidative stress. And we're not talking about supplementing with tons of it. We're talking about maybe a cap a day of like 500 to 600 milligrams of NAC can give you benefit for this. And it gives you benefit for a number of things without any negative side effects, really. In an animal model, so we're talking about probably lab rats and model sleep apnea. I don't know how they do these studies, but what they found was the NAC basically stopped the oxidative stress and the inflammation that occurred as a result of the intermittent, hypoxia or lack of breathing. So they probably just, I don't know what they did. I mean, it sounds probably like a horrific experiment, but cut off their oxygen level, give them the NAC, and see if you can quell it with the quell the oxidative stress. So they saw that was helpful. There's another study, randomized, placebo-controlled study, 20 adults with obstructive sleep apnea. This was 600 milligrams of NAC. It was given 3 times daily for just a month, and you had a significant reduction in episodes of sleep apnea, where you stop breathing or have shallow breathing. Saw oxygen levels improve, daytime sleepiness. Basically you got better, you're less fatigued, and even snoring was reduced a little bit. So it's great. I mean, that's a simple thing to do. NAC is not, and as far as supplements go, is not very expensive. So if you think, okay, well, Keoni's just talking about an antioxidant type supplement, well, then it makes sense that others would kind of fall in line and help with that. And sure enough, vitamin C and E seem to have some potential roles there, especially with what we see in animal models. And they basically help take away the oxidative stress. And also then the other thing about it is you get endothelial dysfunction with this. And vitamin C and E can help with that. So I just tell people, go back to, okay, well, if you don't want to take vitamin C and E, one of the things, at least you're getting some in there, is a good multivitamin, which we did. I think we did a couple podcasts on that and talked about that quite a bit. When you are actually having sleep apnea, you also putting a tremendous amount of stress on your ATP generators, like your mitochondria that basically give your body its energy currency, ATP. CoQ10 is one of those things that can help in mitochondrial energy production. And it has vast benefits. And it's studied quite a bit for the cardiovascular system. It's even been shown to lower blood pressure. If we haven't said this already, blood pressure is closely associated with high blood pressure is closely associated with sleep apnea. Again, it's like this vicious cycle type thing.
Mm.
Um, what can't vitamin D help, right? So vitamin D is another one.
Magnesium better be on this list.
Yeah, well, that's funny you
Could.
said. Yeah, it certainly could help. Definitely.
Yeah.
I didn't put it on my notes to talk about specifically, but yes, you can make a case for magnesium helping significantly. Basically, it can help you sleep can sleep better. I use it as my first line of defense to help people sleep. But vitamin D has some neat research showing, how it modulates the immune system, improves that. It helps with, definitely helps with inflammation. Most people are deficient in vitamin D. So, it's one of those things you want to be on anyway. Vast benefits for the body in a number of ways. Some studies have found that, it's basically association studies. Low vitamin D, okay, sleep apnea seems to be worse. So why not, right?
Right.
B vitamins, I won't talk a lot about that. These are, if you get a good multivitamin, you're probably getting a good amount of B vitamins. I will say B vitamins certainly help reduce an inflammatory marker called homocysteine. Homocysteine is one of those things that the higher the level, the more likely you're going to have a cardiovascular event or neurodegenerative diseases. And B vitamins help reduce that along with a healthy diet. And sleep apnea seems to raise homocysteine levels. So B vitamins are a good thing to be on. Another thing that has anti-inflammatory benefits, and even, there are there's research with, I'm talking about omega-3s now, there's research on omega-3s that they can even, not only do they have the cardiovascular benefits, but they even help with things like obstructive airway diseases, like allergies and COPD, things like that. So, again, taking appropriate level of fish oil has tremendous benefit way over and beyond what it may do for sleep apnea. And I'm saying may because there are some studies on this, but it's not, there's nothing out there that says, yes, take this pill and it's going to, cure your sleep apnea. But I think that's pretty much the topics that I want to cover. Is there anything you wanted to mention or that we missed?
Not that we missed. Sleeping on your belly, really not the greatest thing, obviously for this as well, but in a variety of ways. So sleeping on your side or on your back. And like you mentioned, sometimes the back can, depending on what the issue is that's causing the sleep apnea, can also be worse. So sleeping on your side, definitely just being mindful of positioning.
Yeah.
And then everything you just mentioned is so great, just because most of people who probably have sleep apnea are not like just developing sleep apnea, wake up one day and develop it. And it's probably a host of lifestyle things, of which all of those, if you kind of reverse engineer all those things you just suggested, are going to help with the lifestyle in general, which is pretty much what we do here.
Right. Yeah. It's, it's one of those things that if you catch it early, it will significantly improve your life.
Can you stop it, Keoni? If someone gets on a CPAP, will they get off? Can they get off?
Yes, absolutely, they can. Especially if it is related to weight gain, allergies, kind of subclinical dehydration, allergens in the room. Sometimes I improved it tremendously with people just getting an air purifier in their room, getting rid of the dust and dander, changing. These are things that I should have mentioned at the beginning. Changing your HVAC filters once a month can help, as opposed to doing it every 6 months.
We should do like a lung health episode. Yeah.
Oh yeah. No, these things are huge. And I will even go to the place where here's where the the kind of old wives' tales come in, where you can prevent disease by opening the windows in your house every day, whether it's cold or hot, just getting fresh air in there. Because talk about polluted air. Like, the indoor air is usually much more it's harder on your body than outdoor air, but can be more polluted than outdoor air. So sometimes even simple things like that can help. I mean, I know some people are going, I've had patients who say, well, I can't do that because when the pollen's out, it just kills me when I open the windows. Yeah, that probably plays a role too. So you just want to be smart about it. But just thinking about simple things that can improve your, your breathing.
Yeah.
Practicing nose breathing, like you mentioned, on a daily basis, like in your waking life. Do you tend to breathe through your mouth or your nose? And
Yeah.
that can help. I don't have any, definitive studies on that, but that certainly in theory should help quite a bit. And when my patients do that, lo and behold, yeah, they sleep better. They just generally do better as they
Yeah.
get used to breathing through their nose.
Yeah. And it's related to sleep apnea, but just thinking about the 3D-ness of the lungs. And when you get an opportunity to see those in like a cadaver and kind of play with them and investigate them, the way they project out and all the different tunnels and grooves and everything for just how 3D the lungs are, and that there's lobes here, superior lobes here, lobes in the back, blah, blah, blah. And so thinking about if you're doing like that nose breathing you're mentioning too, you can kind of pick segments of the lung to try and really open up and get some fresh air into. And you can do that with positioning. So like if you're trying to get like the very backs of the lung, kind of hunching over in your chair, really breathing deeply in through your nose and trying to expand that kind of the back rib area or, behind you. And thinking about driving some nice fresh oxygen, just really kind of opening up the lungs as a whole, not as related to sleep apnea, but, long-term lung health and breathing appropriately. That's really beneficial.
Yeah. I mean, and it's,
And we all get really shallow. I do, at least. I'm really stressed.
No, absolutely. We do. And it's funny because I've heard it's kind of, cliche to say this, but it's like, okay, think about what your health is like if you're not breathing for a couple minutes, right?
Right.
What's more important, skipping a few meals or not breathing? It's like things like that. Like your lungs are kind of the seat of your health. I know a lot of integrated docs will be like, focus on, for chronic disease, focus on the gut. But really, it's like all these organs of detoxification are huge, especially the lungs. And a lot of traditional medicines and meditative practices really focus on breathing exercises. We don't really do so much of that in the West, but those breathing exercises, and there's research on it, we talked about it, can help.
Yeah, absolutely. Anything else, Keoni?
I think that's it. Thanks everybody for listening.
Yeah, happy breathing, sleeping, oxygenating, all that good stuff.
Yeah, exactly.
And if you want to support the show, please tell a friend, tell someone who you think would benefit from the show, or someone who you don't think would benefit from the show. Just shout it from the treetops at all times. Subscribe, resubscribe. If you are listening on like a Spotify, a YouTube, your Apple iPhone with the podcast app, you can go to the bottom and you scroll all the way to the bottom of the page where you're listening on the podcast, and you can write us a review. That's really helpful for just letting us be seen and kind of help along the algorithm for us to be seen by more people, help more people, and then we can help more people, which is our goal.
Yep.
Awesome. Until next week, everybody, be well.
Take care, everybody.